Okay, welcome to our Ultimate SCP Reviewer 2025. This will be the first of many, so hang on tight. So we will start reviewing the background story. We have an exam tomorrow. This is the final cramming, the final countdown. Let's go. So first one, this is a website that I've created for trainee SCPs. It's not extensive. Disclaimer, it's not an extensive reviewer, but it should equip us with basic stuff. So first one, the complete guide to surgical wound management. So this is just a visual summary of healing, hemostasis, and closure. So let's go first with the foundations of healing. So effective wound management begins with understanding the body's natural healing process and adhering to foundational surgical principles. These concepts set the stage for successful outcomes. So this will be just a read through and quizzes in the end. So these seven tenets are the bedrock of modern surgical technique designed to minimize tissue trauma and promote optimal healing. First one is gentle handling of tissue. This is Halstead's surgical principles. So gentle handling of tissue, strict aseptic technique, preservation of blood supply, careful hemostasis or control of bleeding, obliteration of dead space, and avoidance of tension on tissues, especially when closing the wound, and accurate tissue approximation. So those are self-explanatory for us. So gentle handling of tissue, of course, you don't want to grasp them with 100% of your might. Strict aseptic technique, of course, to prevent infection, preservation of blood supply, so that the tissues can have their adequate supply of nutrients for healing. Careful hemostasis, you want to control the bleeding early on if you can. And of course, using hemostatic agents. Obliteration of dead space, so that's when closing the tissues, and when you close it, the dead space, if you don't approximate tissues deeper, the deeper tissues, so those can be dead spaces for fluid to build up, and microorganisms love that. Next is avoidance of tension on tissues when closing. When you close and you use your 100% of your strength in tying your knots, those can strangulate the tissues and it couldn't have its adequate blood supply. Next is accurate tissue approximation. Of course, you want tissues to be approximated evenly, so the healing would be okay and less visible scarring, of course. Let's go quickly on the three phases of wound healing. So, definition, simple definition. Wound healing is a dynamic process that unfolds in three overlapping stages from initial response to the final strengthening of the new tissue. First is inflammation, day 0 to 3. Inflammation, day 0 to 3. This is the body's emergency response. Platelets form a plug, and a flood of white blood cells arrives to clean the wound site. So, inflammation, day 0 to 3. We will also go on the uh, cascade of um, cascade of uh, the cascade of coagulation later on. Next is proliferation, day 3 to 20. This is the rebuilding phase. New blood vessels, or what we term as angiogenesis, and granulation tissue form. The wound begins to close. And in line with the three phases of wound healing, it will also be mentioned on the intention of wound healing: primary, secondary, and tertiary, which we will discuss later. Next is remodeling, day 20 plus. This is the final phase. This can go up until a year, so depending on the wound, and it will have a tensile strength of just 80%, the um, final wound that has healed. And this is the final phase wherein collagen is recognized to increase tensile strength. It's a process that can continue for over a year. So I hope that's clear. Next is controlling the field, surgical hemostasis. This should have been one of the final things to be discussed, but we'll discuss it, um, just the basics here, and then we will focus on it more later. So the coagulation cascade, this is just a simplified flow, as I've mentioned. So we have two pathways. The intrinsic pathway and extrinsic pathway, which then goes to the common pathway. So the two, intrinsic and extrinsic. Extrinsic, there will be external trauma, which will have tissue factor release, and there will be the intrinsic, wherein there will be vessel wall damage in whichever pathology it might be. But for intrinsic, it will be vessel wall damage. It will be inside the body, and the extrinsic pathway is it's more influenced by external trauma, wherein there will be a tissue factor release. They will go to a common pathway. Again, we will discuss this more in detail later. Common pathway, which then factor 10 will be activated. This is not factor X. This is not factor X. This is factor 10, which will be activated, which will convert prothrombin to thrombin, and then fibrinogen will be converted to fibrin, which will form the mesh or the clot. So we'll go back to this later, but I want a major takeaway for intrinsic and extrinsic. It will go to a common pathway, which will release factor 10 and activate factor 10, which will then convert prothrombin to thrombin and fibrinogen to fibrin, which will form the clot. Next is we have the art of closure, choosing the right technique. Now, closing a wound is not and never will be a one size fits all, and there will be different. This will be influenced by their training, uh, the where they work. So this is the choice of method depends on the wound's location, tension depth, and desired cosmetic outcome. So sutures remain the gold standard, but other techniques have important roles as well. So this is just a method distribution. So sutures 60%, this staples 20, and next is tissue adhesive 15, and adhesive strips just 5. So let's compare closure options. Sutures, of course, pros: strong, accurate, but it will depend, of course, on its cons, which is the number one. It requires skill, so it requires practice. It takes time, and it will need anesthetic. Next is staples. Pros: it's fast. It's bang bang bang. It will be closed. And then cons: it's less precise, can cause inflammation, and it's just not beautiful. It's not beautiful like the subcuticular closure that I do. Joke. Not joke. Okay. Next is adhesive strips. Pros: it's simple, it's non-invasive. It's just those steri strips. Not my sponsor, but Bacanamen. So steri strips, and its cons: it's the weakest, and it's for superficial cuts only. And it can cause, one of the cons is also it might cause shearing, and it can't be put on high tension areas like elbows, knees, also just superficial. Next will be post closure. Of course, there will be drains and dressings. Now, the work isn't done after the last stitch. Proper management with drains and dressings is crucial to prevent complications and support the healing environment. So, surgical drain trade offs. So, first is closed, or this is the active one. So, closed drains offer more efficient drainage with a lower risk of infection compared to open or passive drains, which rely on gravity. So, the closed or active drains, they have typically a negative pressure that's draining the anything that they can drain. And then the passive drains, these have a more these are more susceptible for ascending infection. So efficiency, so open or passive drains, 5 versus 9. Infection risk, 8 versus 3. And the ideal wound dressing, so a perfect dressing creates a supportive environment for healing. Modern dressings aim to balance moisture, protection, and comfort. So it should maintain moisture. There should be thermal insulation. The best will be non-adherent. It should provide protection. It should remove exudate, and it should be, of course, sterile. It should act as a sterile barrier. So next, wounds by the numbers. So understanding wound classification and the factors that influence healing is key to predicting and managing outcomes effectively. So wound classification profile, it's a nice triangle for you. Wounds are classified based on their level of contamination, which directly correlates with infection risk. So clean wounds have the lowest risk, which are your class 1, class 1. And while dirty or infected wounds have the highest. We'll go deeper into this later on our if you have questions, just place them on the comments. So class 1 is clean, class 2 is clean contaminated, class 3 is contaminated, class 4 is dirty or infected. So class 1, these are your planned incised wounds. Class 2, clean contaminated. These are your wounds that you will access for example, the intestines, the vaginal canal. Class 3 is the contaminated. So class 2, one good example as well in class 2 will be appendicectomy. And so that's one thing to remember. Class 3, we could also do appendicectomy, but this is the ruptured one. So class 3 is the contaminated. So this is your ruptured appendix. So class 2, the unruptured appendix. Class 4, dirty or infected. So infected wounds or those with external trauma that that penetrated the skin or the tissue inside. Next, factors influencing healing. So there will be a range of systemic and local factors that can either promote or hinder the body's ability to heal. So your promoters with the thumbs up, good nutrition, especially protein, adequate oxygenation, moist environment, good perfusion, and of course your age, so youth, which directly correlates to advanced age for inhibitors. So malnutrition, infection, advanced age, chronic disease such as diabetes, or some of your vascular pathologies. Next is immunosuppression. So some patients have immunosuppression therapy ongoing, or if they're on steroids. So next, let's go to wound management quiz. So which of the following is not one of Halsted's principles of surgery? So this is one, this one. So use of tension. So next is a surgical wound. So I encourage you to answer this. So I'll see you in the next video.